and what we can do. So what is mental health, mental illness? It comes in many forms. Some of them you have already probably heard of, such as autism, anxiety, attention deficit hyperactivity, bipolar, depression, post-traumatic stress disorder, schizophrenia, psychosis. The list is endless. That's what mental illness is. Who is affected by mental illness? Mental illness affects 42.5 million Americans. That's over 18% of us. Of that 42.5 million, 9.8 million of us, which is 4% of the population, they suffer from a severe mental illness. If we look at the children's group, the teenagers, aged 13 to 18 years old, 1 out of 5 is affected with a serious mental illness. That's 21% of this age group. 75% of all mental illness starts before the age of 25. If we look at my age group, which is 55 and older, 20% of this population is affected by a mental illness. And this particular age group is the age group that is less likely to seek treatment, despite the fact that we know that 75% of the people who do seek treatment report saying that it has improved their quality of life. So that is a little bit who is affected. Mental illness is a non-discriminatory illness, which means that it does not respect cultural, racial, religious, gender, socioeconomic boundaries. It can affect any of us. But how? Based on a multitude of channels, mental illness can go through various doors. For example, there's the genetic factor. There is the factor where people are raised in very abusive family environments. People are living inside of very abusive relationships. Some people have suffered severe personal traumatic experiences. And there's PANS, which is Pediatric Acute Onset Neuropsychiatric Syndrome, which simply means that some children, when they contract the common cold or the common flu, it triggers in their immune system an attack on their brain, leaving in the wake a mental illness. So that's the how. What can we do about it? Should we do anything about it? 1 in 4 of us here in this room will be faced one day or another with a mental illness challenge. Children, teenagers in particular, they do not request treatment until 8 years, an average of 8 years after the onset of their mental illness. Why? Because of stigma. 90% of the people with severe mental illness are unemployed. Why? Because of the stigma on mental illness. 2/3 of the Americans who have health insurance that cover mental illness therapy and treatment never use it. Again, why? Stigma. So what can we do about it? We can talk about it, because mental illness is in the closet, and it's a huge animal. Like I said, 1 out of 4 of us are going to be faced with it one day or another. But do we need to talk about it? We do. Because these people who are suffering from mental illness are not coming out and seeking treatment early because of the stigma associated with it. And we can help by just pulling the monster out of the closet. How? By discussing, by talking about it. This discussion, I hope, has just pulled the monster out a little bit so that we're less afraid of it inside the closet. I have brought also, which I'll pass around for those of you who would like to create meaningful conversations with loved ones who might be living with mental illness. It's a tool. I also have a magazine I'll lend out that, for anyone interested in reading more about PANS, the pediatric syndrome that I referred to earlier in the discussion, there's an article on it in here. And lastly, I'd like to pass out some green ribbons for those of you who would like to wear it this month to promote dialogue on mental illness to help bring it out of the closet. Please feel free to take a green ribbon. Okay. And Placer County does have lots of other resources on our website if you'd like to learn more about mental illness. We even have a video link that will put you in contact with Glenn Close, the actress, who also helps discuss it to bring about this dialogue. Thank you.